Dr. Alla, once again, what is POTS syndrome? So I get this question a lot. POTS syndrome or dysautonomia or autonomic dysfunction is, there's a lot of terms and a lot of names people throw around for this. POTS actually stands for postural orthostatic tachycardia. When you're laying flat, you're fine. As soon as you stand up, your heart starts racing, you get lightheaded and dizzy. Another name is dysautonomia or autonomic dysfunction or orthostatic hypotension. There's all kinds of names for it. This is a condition where, and it's usually in young people, and it's 10 to 1 male to, female to male. 10 females have this for every 1 male that has it. But it's a condition where we don't really know the cause. It can be anything. A lot of times it's triggered by a life-changing event. Somebody got a new job, has a lot of new stress at work, got fired, had an abortion or a miscarriage. It could be a lot of things. Or they were pregnant and now gave birth, or they were never pregnant and now they suddenly got pregnant. It could be anything. Something somehow seems to trigger it. And we're not sure exactly why this is, but it happens. So the way to treat it is, first of all, rule out all the regular stuff. Get your echograms, get a stress test if the patient needs it, get an EKG, make sure the patient doesn't have anything organic going on. If they have like really bad aortic stenosis or some kind of really bad problem, then you have your answer. But if they don't have any of those things and their echo is stone cold normal, they did a stress test, they're very active, they're good at, they're very healthy otherwise, there's a few things we can do. Number one, if the patient is always tachycardic, make sure they're hydrated. They can wear TED hose, and you can put them on a beta blocker like metoprolol. Metoprolol is very good at lowering your heart rate without affecting your blood pressure. The problem with these people is they get really low blood pressures. If the problem is primarily a low blood pressure problem, you can put them on a medication like Florinef, which is a type of steroid that makes you retain salt and water. Of course, you tell the patient to stay hydrated, get your electrolytes, eat more salt than usual. But this Florinef makes it so even if they don't do that, they will retain a little more salt and water, and you got to balance it. You don't want so much Florinef that they starting to get puffiness and swelling in their legs, and you don't want so little that it has no effect. So you want to try to get that. Now, if somebody's on Florinef, you want to check a BMP after a few weeks, because some people get very hypokalemic. Florinef, especially on higher doses, the 0.1 milligram a day might not do it, but if they're on 2, 3, or 4 of those a day, you probably should be checking a BMP to make sure their potassium is stable and put them on potassium if they need it. Now, if they're on Florinef and metoprolol, and that seems to solve the problem, that's great. But there are some people where that's not enough, and they need something like Celexa, citalopram. Now, if you read about this, it's an anxiety or depression medication. I'm not a psychologist. I treat cardiac conditions, and dysautonomia or autonomic dysfunction is one of them. So Celexa, for whatever reason, raises your blood pressure. It does get rid of some of the anxiety that can cause it. Some people just get super anxious. They feel like they're going to have a panic attack, and that adrenaline rush causes their heart to race, which causes their blood pressure to drop, which kind of like triggers this whole cascade. So if we can knock it out at the anxiety side with something like Celexa, and then knock out the tachycardia with something like metoprolol, then I think we'll do really, really well. So that combination works really, really well. If they're still a little, hypotensive, you can add Florinef in that case. Celexa does take about 5 to 6 weeks to kick in fully, so I always tell my patients, be careful. Don't just write it off that it didn't work right away. Give it about 5 or 6 weeks, and I need a lot of feedback from you. You need to tell me if this is working. If you feel 10% better, great. If you feel 80 or 90% better, great. I need to know those. I know to know if I need to up your medications or not, or if I could leave everything the same. Hope you enjoyed this topic and share this with your friends.